As COVID cases rise in the UK, there could be newfound hope. Medical officials in Britain approved Merck's potentially landmark antiviral pill to treat the coronavirus. The medication will be available for people with mild to moderate symptoms, as well as those considered high risk. Now, this comes as COVID cases nearly doubled in England for people 65 and older during September and October. So for more on all of this, let's bring in Imtiaz Tyab. He is joining us now from London. So this is really interesting. We've been hearing about this Merck pill for a while now. Can you help paint a picture of just what the current situation is in the UK, though, regarding COVID?
Anne-Marie, Vlad, good to talk to you. Yeah, the situation here in the UK, it's not great. And we only really have to look at the numbers. And numbers really matter when it comes to COVID. The UK is recording around 40,000 COVID cases a day, an estimated. If you compare that to, say, the US, which is recording around 75,000 cases a day, you sit there and you think, okay, well, obviously it's worse in the UK, in the US. But here's the crucial difference. The population of the US is 5 times greater than in the United Kingdom. And so suddenly you look at these numbers of the two countries which record some of the highest COVID cases every single day. The UK suddenly the situation looks a lot more dire. In fact, one public health person describing it as COVID sort of sloshing around the country. And as we've been saying, what we've also noticed in recent months is that people over this age of 65, the first people in this country who received vaccinations, are the ones who are coming down with COVID. Now, as we've been saying, Britain has one of the highest rates of vaccination, but the fact that so many people over the age of 65 tells you that even though we have these high rates of vaccination, that these new variants of COVID, that we're dealing with a different variant of the Delta variant, that is basically crashing through the protections that the vaccine gives us. And that's why we're seeing these numbers. And that's causing a huge amount of alarm in this country.
So, Imtiaz, some experts warn hard months are going to come in the winter. How is the NHS handling things?
In short, the best they can. The NHS, like every healthcare system, and the NHS, of course, is Britain's national healthcare service, a government-funded, government-run healthcare system. I mean, they're exhausted. You see reports of doctors, nurses, medical aides just saying that they've been battling this virus for so long, and yet wave after wave keeps crashing over them, and that they're just really struggling to contain it. And now that we have some of the most senior figures within public health here in the UK warning of even worse months to come ahead, now that we're entering these cold, dark winter months, that again is causing even more alarm bells. Is Britain's healthcare service, which is a really robust healthcare service, is it going to be able to handle the strain that many are predicting? And if you talk to doctors and you talk to nurses and you talk to public health officials on the ground, they're saying they're not ready.
So then we know that, almost all coronavirus restrictions were lifted in England back in the summer. Is there any talk or possibility of restrictions coming back then?
So, Anne-Marie, Vlad, this is where science and public health and politics diverge, right? If you talk to people, to scientists, they say we need to implement some restrictions, right? Britain, the British government essentially removed all restrictions this summer. None are in place, none that are legally enforceable, that is. And so people have essentially been free to do whatever they want. In fact, the deputy deputy minister for health has essentially said that most people in Britain are living as if the pandemic is over, which it clearly is not. But the Prime Minister, Boris Johnson, has made it relatively clear that he doesn't want to see another national lockdown. So the government has come up with a strategy, a plan A and a plan B. Plan A is to get booster shots into as many people as possible. Plan A is to get as many people to get or to get flu shots as well. But it doesn't look like that's going to be enough to prevent coronavirus from spreading in the way that we're seeing it is. So plan B will be enforcing people to wear masks. Plan B could also mean asking people to work from home. Plan B could mean reimposing social distancing requirements. But whether you implement either Plan A or Plan B, if the coronavirus continues to spread the way that it does, many people are saying, listen, we have a real problem here, and that a lockdown may be the only way forward. But as we've been saying, when politics and science aren't in the same path, I think it's going to be very difficult for the Prime Minister to enforce a national lockdown again. It's very clear that he sees it as too devastating for the economy, but perhaps more importantly, there are very loud voices within the Conservative Party who see it as the government impinging on people's lives, their freedoms. And so there's a lot of things being balanced here, but perhaps more importantly, other countries around the world who haven't lifted these restrictions are looking at Britain and thinking, we're not going to do that. We're not going to make the mistake of removing all restrictions, letting people go live their lives the way they want to while the coronavirus is still circulating.
Wow. This is a real challenge. So I guess the Imtiaz, the first pill designed to treat symptomatic COVID has been approved by regulators in the UK. And so I guess the question for those of us across the pond is, what are the clinical trials showing about how this treatment works?
So this sort of very dark and gloomy picture I've painted for you, we do have this sort of crack of sunlight coming through. Britain's version of the FDA has approved a pill, and I'm not going to try to say the name of it because I'm going to mangle it, but this is basically an oral pill that you take, and it's really for people who have moderate or into not extreme forms of COVID, but the kind in which you're struggling to breathe, high fever, et cetera, et cetera. This medication has proven in these clinical trials to really reduce those symptoms. In fact, some of the research shows that it can reduce it by up to 50%. And it's being described as a game changer here, that if people who take this medication, that we can reduce their symptoms by 50%, that means we're not going to see people going to hospitals. That means those people who have pre-existing conditions or comorbidities, that they may not be at risk of losing their lives or being treated for extreme forms of COVID because of this medication. So it looks really good. And we do know that the FDA is also really looking at this medication. And we believe that sometime later this month, they're going to come together to discuss whether or not they're going to release it to the wider public, much in the way the UK has, which again is still relatively limited. But there's a problem. And the problem is the amount of medication available. We understand that the manufacturer says that it can produce up to 10 million doses before the end of the year. That's, in the grand scheme of things, not a huge amount. So while there's a lot of hope with this medication, the British government clearly seeing it as an effective tool in fighting the coronavirus. And if it is, and is something that can help a lot of people around the world, the next big step is to try to figure out a way to really ramp up production so that the numbers and the situation that we're seeing here in the UK and indeed in the US and many other countries across Europe as well, where we're seeing the coronavirus just surge again, that this could be yet another tool in the arsenal in fighting this very deadly virus.
But Imtiaz, let me just let me ask a follow-up real quick about that. 10 million doesn't, I mean, there are some 67, almost 70 million residents in the United Kingdom. I guess the question would be, how many of those folks are vaccinated? Because, if they're worried about 10 million, I'd be worried that there are 10 million people out there who could potentially need life-saving medication because of COVID, which would suggest that they're not vaccinated.
Yeah, I think the UK, we can make a bit of a distinction here. We know that the UK has some of the highest rates of vaccination in the world. In fact, one of the things that the UK government under Boris Johnson needs to be lauded for is its vaccine rollout. It was one of the first countries to approve the vaccine, which we now see as very effective, which is the Pfizer vaccine. And it has gotten into the arms of the vast majority of the population. In fact, the vast majority of the British population is double vaccinated. And that's why when we talked about Plan A, where the government wants booster shots, wants people to have flu jabs, that they see that as possibly an effective way to bring down these COVID numbers. Well, it would seem that the variants that are now circulating have different plans, and that's where things like mask mandates and social distancing, et cetera, come into play. But to circle back to your question about the concern about like whether we need to actually produce this amount of medication, look, the short answer is we also don't know how long people need to be on this medication for. There's a lot of questions that remain on the pharmaceutical side of this, and that is why Britain leading the way in terms of spreading it out around the public. And we have to be clear here, with 40,000 people coming down with COVID every single day, with hospitals saying already here in early November that they're struggling to treat it, there is a need here. And I think the data that we are able to collect here in the UK will help inform the FDA and help inform other countries across Europe and indeed around the world who are looking at this medication, who are looking at their COVID numbers rising and hoping that this could be yet another tool in their arsenal to fight it. And of course, vaccines being very effective, but as we've been seeing, as the coronavirus mutates, we see more and more people who are double vaccinated essentially coming down with the virus. It's reduced the death rate considerably, right, by 90% in some cases. But still, there's too many people who are getting very, very sick, too many people who are dying, and that is still a huge strain on our healthcare systems. And so that's why many people are hoping this medication could be, again, a game changer as we continue to deal with this very global pandemic.
You know what I was thinking, Imtiaz and Vlad, about this Merck pill is you also don't want people to start to think, oh, well, if I get sick, I'll just take that pill. It's readily available.
Right.
And so they don't kind of take the precautions that they need to.
Yeah.
Maybe they don't go get that booster shot. And Imtiaz is talking about, what he said was that the people who got the vaccine quite early are the ones that are kind of more susceptible now. Well, those are probably going to be the older people, and there's a good possibility that if they don't get that booster shot, they could really get sick. And suddenly, all those doses of that Merck pill doesn't seem like an awful lot.
Yeah, and very quickly, I'll just add to that is what we've learned time and time again, and I think what we're failing to learn just sort of as a wider public is we have vaccines, we have masks, we now possibly have a medication which can help, really reduce the symptoms of COVID. We have all of these tools, but we also know that there are things we can do in our everyday lives which can help with this pandemic, which is wear a mask, sanitize your hands, social distance. If you're one of those people who can work from home, do that. That's how this virus is going to be tackled. All of these other things shouldn't lull us into this sense of security, because I think what we've been seeing here in the UK, because restrictions were lifted so quickly, because people were vaccinated so rapidly, and it was hailed as this success, that all of those things are great and really important, but it's not enough to really put an end to this pandemic. And that's what I think we're all hoping for, is an end. But as we've been seeing in the data, as we've been seeing in the numbers, particularly here in the UK and indeed across Europe as well, is that we are still very much in the grips of the coronavirus pandemic. And although we have these really great tools to fight it, this battle is far from over.
Indeed. Imtiaz Tyab, always great to have your reporting on our air. Thank you.